Good afternoon and welcome to Downing Street for the daily coronavirus briefing. This is a particularly timely publication because right across the world, people are angry about racial injustice. And I get that. Black lives matter. And I want to say this to everyone who works in the NHS and in social care. I value the contribution that you make, everybody equally. And I want to say it right across society too. I want to thank you, and I want you to know that our whole country cares about your well-being. And I value too those who come to our country to work in the NHS and in social care. And I love that this country is one of the most welcoming and tolerant and diverse. That goes for the whole country, and it goes especially for the health and care system. As I said in the House of Commons earlier, PHE's investigation found that age is the biggest risk factor for coronavirus. Next, gender. Living in a city is a risk. And being black or from a minority ethnic background is also a significant risk factor. There is much more work to do to understand what's driving these disparities and how the different risk factors interact. And we are absolutely determined to get to the bottom of this and find ways of closing that gap.
Normally a report like this would take us a good 6 months, so we've actually produced the sort of analysis that in a relatively short time, and we need to get the report widely disseminated and widely discussed before, I think, deciding exactly what needs to be done. But clearly there are some fairly obvious conclusions that can be drawn even from the data that we have.